The Joint Strategic Needs Assessment, usually shortened to the JSNA, is a continuous process by which local health and wellbeing boards across England assess the current and future health, care and wellbeing needs of the local population to inform decision making. The Wakefield JSNA is hosted on a website where information about a number of relevant topics to the health of Wakefield District residents is summarised and presented. A short video explaining what the JSNA is and how to navigate the website is available on the Welcome to Wakefield JSNA introduction page. Each year, 2 JSNA annual reports, one for adults and one for children, provide an opportunity to focus on the most pressing health needs in Wakefield District. This presentation summarises the findings of the 2025 JSNA Wakefield Children's Annual Report, focusing on those aged 0 to 17 years living in Wakefield District. This report summarises the findings in several key areas relating to children, exploring health, risk factors, protective characteristics, population groups and health protection. A PDF copy of this report is available on the JSNA website for further reading. The copy of the report on the website includes interactive links. Just click on the More Info text to be taken to web pages with more detailed information. Within the report, comparison is made between the picture in Wakefield and other areas, including the national and regional figures. Colour coding is used to show whether Wakefield is a worse, or in line, or better than the comparator. Across the district there are 75,000 children, about 1 in 5 of the population. The number of children is expected to stay relatively stable over the next 10 years. There were about 3,500 births to Wakefield mums in 2023. The birth rate has been declining over the last few years, similar to trends both regionally and nationally. About 8 out of 10 children in Wakefield are of white British ethnicity, which is a higher proportion compared to nationally. The percentage of children who are from an ethnicity other than white British has increased over the last 10 years, from 13% to 19%. People born in Wakefield are not likely to live as long as children born in other areas of the country. Both males and females have a life expectancy at birth about 2 years lower than the England average. There are also inequalities in that those in more deprived areas of the district have a lower life expectancy. Further context to the JSNA annual reports can be found in the State of the District report. There are many wider determinants that will impact on children's health. This report gives more information about the people and places in Wakefield, including living environment, economy, housing and education. The next section highlights some of the areas of health that are most important to consider in Wakefield District that affect children. It is important children get a good start in life, and Wakefield has worse outcomes than seen nationally for several pregnancy and early life related indicators. Nearly a third of pregnant women in Wakefield are living with obesity, and 10% are smoking at the time of delivery, though this has seen a major reduction over the last 10 years due to a number of successful local initiatives. Breastfeeding can help improve the health of mums and babies, in the short and long term. Rates are lower in Wakefield compared to nationally when looking at first feed and at 6 to 8 weeks old. Living with overweight and obesity can have long-term effects on a child's health. The National Child Measurement Programme is a government scheme to understand childhood weight and patterns and trends, which measures children in reception and Year 6 annually. The percentage of children living with overweight and obesity was higher in Wakefield than nationally in younger children, and similar to the national average in older children. A higher proportion of the older children were living with overweight and obesity. Children living in the least deprived areas were less likely to be living with overweight and obesity. Children living with overweight and obesity are at higher risk of adult obesity and related health problems such as high blood pressure, type 2 diabetes, and cardiovascular disease. Older children were more likely to be living with obesity if they were living with overweight or obesity when they were younger. Asthma is the most common long-term medical condition in children in the UK. Hospital admissions for asthma in Wakefield are similar to regional and national rates. Smoking, environmental tobacco smoke and poor air quality can all lead to an increased risk in hospital admissions for asthma. The school health survey, which is carried out every 2 years, gives us information about the health and well-being of children in the district, including the environment they live in, and will be referenced throughout this report. The results from the survey found that 16% of pupils reported someone smoking in their home, and this was higher for children living in the most deprived areas. Poor oral health can have a major impact on a child's overall well-being, including their ability to eat, sleep, or concentrate at school. Hospital admission for tooth decay is at double in Wakefield compared to regional and national rates, but has been falling in recent years. In West Yorkshire, figures show 6 in 10 children have seen a dentist in the past 12 months. Looking more closely at Wakefield in the school health survey, it was found 3/4 of children had seen a dentist in the last 12 months, and a high percentage brushed their teeth at least twice a day. Mental health is as important to a child's well-being as physical health. A new topic on the JSNA has covered this area in depth, and more information can be found on the Wakefield JSNA website. 1 in 5 8 to 16-year-olds and 1 in 4 17 to 19-year-olds have a probable mental disorder nationally. Locally, the School Health Survey is a major source of information about children's mental well-being. In the 2020 and 2022 school health surveys, mental well-being decreased, possibly due to the impact of the COVID pandemic and associated school closures and lockdowns. But there was evidence of a recovery in 2024, when 1 in 20 pupils in years 7, 9 and 12 had a low mental well-being score, which is more similar to previous surveys. Females and young carers had lower levels of mental well-being, which is a trend seen over a number of surveys. There are factors children are exposed to that can have negative effects on their health and well-being. These include smoking, vaping, alcohol, and drugs. Again, the Wakefield School Health Survey helps us gain insight into some of the health behaviours of children and young people in the district. The survey has found an increasing percentage of children have never tried smoking, and that this percentage decreases with age, with very few Year 7 pupils aged 11 to 12 having tried smoking cigarettes, increasing to 3 in 10 for those in Year 12 aged 16 to 17. Vaping is used as a way to help people stop smoking, but there is concern about the number of young people taking it up as a habit who haven't previously smoked. More pupils had tried vaping compared to smoking cigarettes in each year group, with over half of Year 12s having at least tried vaping, and 1 in 5 reporting using a vape every day. Pupils were also more likely to think it was okay for people their age to vape compared to smoking cigarettes. An increasing percentage of pupils in the school health survey had never tried alcohol. This is also seen nationally. For Year 9s, the number of pupils saying they had never tried alcohol has doubled since 2013. A higher percentage of pupils in Year 7 hadn't tried alcohol compared to Year 12, where only 1 in 5 had never tried it. Year 9 and 12 pupils were asked about drug use, and it was not common in Year 9 pupils. In Year 12, nearly 80% of pupils had never tried drugs, and the most common drug used now or in the past was cannabis, which is similar to the national picture. There are several protective characteristics that can act to improve children's health and well-being. These include diet and fitness, safety and well-being, and education. Looking at diet and fitness, less than half of 5 to 18-year-olds in Wakefield meet the government recommendations for physical activity. This was similar to regional and national levels. The school health survey includes a number of key statistics in the area, including that 1 in 4 pupils hadn't eaten breakfast and that activity levels decreased with age. The survey also included insights into the barriers children report to doing more activity, including not having time, not feeling motivated or bothered, and worries about looking silly. Favourite activities including running, football, swimming, gym sessions, and dancing. The School Health Survey gives us a lot of information about the well-being of children in years 5, 7, 9 and 12 in Wakefield District. More than 6 out of 10 children felt happy with life, and though percentages were higher in 2024 than in 2022, they were still not quite back to the level of previous surveys. Nearly half of pupils felt lonely some or most of the time. A good night's sleep is important for a child's learning and development. Just over half of the children in the school health survey had 8 or more hours sleep a night. The percentage of children getting this amount of sleep decreased as children got older. Overall, 3/4 of pupils in the school health survey felt safe in the area they lived. Education is an important part of children's lives, and over 2/3 of children aged 4 to 5 in Wakefield achieved a good level of development similar than national and higher than regional levels. Attainment when children were 15 to 16-year-olds was the same as regional and national levels. Levels of 16 to 17-year-olds not in employment, education, or training is lower than the regional and national averages. Since the COVID pandemic, school absence rates have increased nationally and in Wakefield, with 1 in 5 pupils missing 10% or more of their schooling in the 2023-2024 academic year. Some groups of children in the population may need additional help and support to ensure they achieve their potential. Different groups are highlighted in the annual report, but further information on other groups can be seen on the Wakefield JSNA page. Children with identified special educational needs and disabilities, also known as SEND, are provided with extra help at school. Some receive SEND support, which is usually given in a mainstream setting. Those with more complex needs will have an education, health and care plan, which may include attending a special school. Just under 2 in 10 of the school population in Wakefield, so over 11,000 pupils, have identified SEND, and there is an increasing trend similar to seen nationally. A higher percentage of children with special educational needs in Wakefield attend mainstream settings. There are over 2,300 children in need of services in Wakefield. They receive extra support from social workers and other professionals. They are at higher risk of poorer health, education and well-being outcomes. Such children may be subject to a child protection plan to protect them from harm or being care provided by the local authority. Rates of children in these groups are lower in Wakefield when compared to other similar local authorities across England. Members of the LGBTQ population may face barriers to accessing the help and care they need. Analysis of data from the School Health Survey from students in Year 12 found that LGBTQ students were more likely to be affected in a number of ways, which could lead to poorer health outcomes. This included a high likelihood of being bullied, suffering from a possible eating disorder, and having lower mental well-being scores than other pupils. A larger percentage of young people identified as LGBTQ+, compared to older age groups in the Adult Health Survey. A young carer is a person under 18 who regularly provides emotional and/or practical support to a family member or friend, for reasons including chronic illness and mental health problems. Due to the help they are providing to others, young carers may face difficulties themselves. This may include in school and physical or mental health problems. The School Health Survey showed that young carers had more negative outcomes in a number of areas, including being less likely to brush their teeth or be happy, and be more likely to be exposed to cigarette smoke and feel lonely. Health protection includes protecting children from infectious diseases and environmental hazards. Routine vaccinations are offered to children across Wakefield District, and take-up is higher than the national average. Overall, though, coverage is lower in some population groups than others. Vaccination programs were disrupted during the COVID pandemic, and there continues to be lower uptake, with vaccination rates lower than national targets for preschool aged children. Thanks for listening to this summary. There is more information on the JSNA Wakefield website.